Hi everyone, my name is Dylan Grant and thank you, welcome to 2017 as I continue my presentation on discrimination here in Canada. I'm up against two giants here, two well-known companies here in Canada, and the system is backing these two entities that did me wrong. Bell Mobility and Manulife Insurance. I was fired from my job of 20 years, as I made mention in my first presentation. Okay, I have divided 2017 into two parts because a lot went on. A lot. For now, I'm just pointing out the information regarding the medical records, what I have in my possession and what is at the Ministry of Health, the false information that's at the Ministry of Health, because they distorted my medical records to cover up for these two entities. Okay, please feel free to pause and read as you go along, because I will try and go as fast as possible. Okay, thank you. Here it shows that I went to Great Lakes in February, on February 11, 2017. Okay, the thing is, I obtained, just let you know how this letter originated, right? I went to Great Lakes. I was going to Great Lakes since January of 2019, not knowing that my medical records were being distorted. I tell you, God was ahead. In everything, God has been ahead of these people. He has been way ahead of them, right? So not knowing, I went in January, could not get my medical report. It's my right to ask for my medical records, right? And they wouldn't give it to me. They told me to ask my lawyer. I did have a WSIB lawyer, as a Workers Safety Insurance Board lawyer, right, to appeal my case, WSIB case that was denied because of the mobility and Manulife insurance, right? Solidarity, systemic racism, and not knowing at the time, right? And I was just thinking, why should I ask my lawyer for my medical record, right? Eventually, thank God, in February, I got this letter. I said, could you just give me something just to confirm the days that I was at the at your clinic? Thank God. Here are the dates. So you will see this popping up now and again. Here are the dates that from 2016 up to 2019 that I went to this clinic, Great Lakes Medical Center. Okay, and it confirms that I have decorative tenosynovitis, and as it said, these are the following days that I went to. Sorry, the clinic. Okay, and they did record Decorative syndrome, which is same with decorative tenosynovitis. Now the Ministry of Health indicated signs, symptoms not yet diagnosed, musculoskeletal system, leg. Please write this down. And I have a reason why it pops up now and again. Because if it's not yet diagnosed, I'm thinking here they have a plan for me. Yeah, the system. That is, okay? Because it has been diagnosed, decorative tenosynovitis, so they're saying I have a leg problem, I think, or whatever, not yet diagnosed, okay? Please feel free to pause and read. Okay, it says February 11th here, 2017. February 11, 2017. Okay, Decovane, and that's what they have. Be free to pause and read. All should say 727. All right, tenosynovitis. I saw Dr. Handelsman, the specialist, on January 26, 2017, and he confirmed the COVID tenosynovitis, and he sent me to the Sunnybrook Hospital for the cortisone injection. The injection wasn't administered because I guess during therapy I was doing physio, right? And the icing of the hand, I guess the inflammation, there was no fluid, no inflammation, but my tendons were still swollen and decorative tenosynovitis was still confirmed. Okay, this is for the 15th of February 2017. Okay, however, I'm not sure if this is the proper way of describing my situation. A doctor will know I'm not a doctor. It says diag ultra miscellaneous, I guess, extremities per limb. That's it here. I'm not sure if it's talking about the same thing here. I guess I just put it forward just in case if anyone know if it's the same thing or it's not. All right, you can make your comment. All right. And on February 21st, 2017, I went to my doctor, Dr. James Chang, because I was a member of the Chartered Professional Accountants of Ontario, right? And I could not attend school because of Bell. I had to see school sees my career goal. Of being a chartered accountant because of Bell mobility, because the work got unnecessarily demanding, and to keep my job, I had to see school for the time being. I thought, not knowing that eventually I would have had an injury. So the doctor wrote here, the above patient has been off work since September 2016 due to tendonitis. There it is. That's right here. She is still unable to work at present on the further notice. Okay, this note, February 21st, 2017, was put together for CPA, which is Chartered Professional Accountants of Ontario. Okay, however, the Ministry of Health recorded benign neoplasm uterine fibroid leiomyoma. 21st of February 2017, 21st of February 2017. You can see two different things here, right? If this is regarding to fibroids, I have been fibroid free since 2003. Not sure what this is. Okay, please feel free to pause and read. Everything should supposed to be saying 727. Okay. Here is proof to show that on February 16, 2017, right, the Chartered Professional Accountants of Ontario requested a medical proof, right, because I was unable to pay membership fee and all that because of my injury. I needed time, right? Because I thought I would be back in school, but no, I got an injury. So here I got this request. I have been requested to ask for more information to support then medical deferral, right? And then on the 22nd of February 2017, okay, a day after I got doctor's note, I sent the attachment. Please see attachment. I sent it off to the Chartered Professional Accountants of Ontario so that they could understand that I'm not able to pay membership fee or attend school at the moment. So please advise if the note is acceptable. Please feel free to pause and read. Thank you. This one is very interesting. Here on the 20th of March 2017, they do have here diabetes mellitus, including complications. Diabetes mellitus. Including complications and other things here. I'm getting to them. Okay, I'm going down. Okay, on 15th of March 2017, I was sent back to work to use my left hand. Yeah. Dr. Handelsman, and I will show you proof. I can see that he was under pressure from MANULIFE. I could tell. My doctor was acting strange, Dr. James Chang, and now this specialist, at the beginning, it was okay the first visit, but then he was under pressure from MANULIFE insurance and actually approved that I return to work to use my left hand. Can you imagine? MANULIFE, Bell, Mobility, and a specialist knew that I still had the injury. Okay? Please feel free to review. Okay, I'm getting to these others. Okay? All right. Here is proof that MANULIFE insurance had sent to Dr. James Chang, including myself, that I should return to work the week of February 6, 2017, right? And Dr. Handelsman said no. Then what MANULIFE did included some other information. So this letter, they actually had some inclusions on February 23rd, 2017. 1, 2, 3, which I've indicated here, right? It says, please note that in order to approve the absent on short-term disability benefits, the employee has to be considered as totally disabled from performing her job task despite the accommodation offered by the employer. Number two, this is they wanted me to return the week of March 7th, right? It says, please, 2, return to work, week of March 7, 2017. 3, working at a slower pace, allowing the employee to work with her left hand only. Dr. Handelsman responds, no. I'm not left-handed, I'm right-handed. And he responded, no. We'll reassess. Okay? And on the 7th of March, as he indicated here, I wasn't, I would say, I wasn't re-examined. He got the result. Dr. Handelsman got the results from Sunnybrook Hospital, because remember I visited the hospital on February 15th, right? He got the result from Sunnybrook Hospital, and he knew that I couldn't work. He told me what he said out of mouth. He said, return to work and you'll be off work again. I guess this doctor, I know this doctor didn't understand my company. My company, Bell Mobility, wouldn't care less. As long as he sent me back to work, they wouldn't care. They just figured that they will overlook my injury. I know them because other people's experience. I know my company. I'm not the only one, right? But I'm the one here with proof. Anyway, the doctor letter, as you will see it in my other presentation, was not in my favor eventually. I knew definitely that he was fearful of MANULIFE. That's why I didn't want to handle my case. All right, I will get to that in another presentation. Okay. As you can see here, the 20th of March 2017, the medical records indicated diabetes mellitus, including complications. Dr. Handelsman report on January 26, 2017 indicated she's not diabetic. I'm not sure why he even included that, because I've been healthy. The only complaint right now was my hand, so he didn't even have to write that. But anyway, it says she's not diabetic. Okay. Then, as I said, I visited my doctor's office on the 20th of March 2017, and he did indicate ultrasound still shows tenosynovitis. Okay. And I also visited my doctor on April 10th, and as you see, it says I was complaining about the physiotherapist. Yeah, everyone was doing me wrong. Yeah, and you will see it in my other presentations. Everyone was doing me wrong. So I was telling my doctor, which he noted here, she's seen a therapist, that is physio, right? Not quite to her liking, because I was explaining what was going on, not knowing that I was ganged on by the system since 2016 actually, right? And here it says 3, wrist still slightly swollen. Okay, because eventually Dr. Handelsman sent a report to MANULIFE to say there was no more swelling and my hand was okay. The physiotherapist is also saying there was no more swelling and all that. I'm thinking, what's going on? Soon get to that, okay? In the meantime, okay, based off my evidences, I guess they're trying to mess up my medical record to say there are other things. Now I realize, I will let you know. You'll figure it out with me, right? I figured out, you'll figure it out also when I show you exactly what this medical report for the Ministry of Health is doing. All right. Here, Dr. Handelsman stated that thus at present, she may have a right decorative tenosynovitis. Would you believe that she sent a letter? I didn't want to go to this doctor again because I was sent back to work to use my left hand. So I asked my doctor, Dr. James Chang, to refer me to another specialist, but he told me to still return to Dr. Handelsman's office. I was not treated right at Dr. Handelsman's office. Oh yeah. I will get to that in another slide, okay? In another presentation, that is, okay? I didn't get the necessary care. He was writing all of this, and I just only spent maybe, I don't know, maybe a minute or two or so in his office. No. Anyway, they wrote here for this, see, the 12th of June 2017, right? They wrote other diseases of musculoskeletal system and connective tissue. Okay, that's wrong. It's supposed to be 727. All right, and because of the treatment by Dr. Handelsman, honestly, what I did, okay, please feel free to pause and read if you like. Okay, what I did, I went to Great Lakes Medical on the same day, as you can see, June 12, 2017. Okay, the Crevane syndrome, and as you can see, There are two dates here. This first date is this first one is for Dr. Handelsman, and they're saying other disease of musculoskeletal system and connective tissue. It's supposed to say 727. Okay, see, I went here to Great Lakes Medical for answers, and they have it correctly here, tenosynovitis. Okay, this one is very interesting. So I went to Dr. James Chang's office on the 17th of July 2017, and this time around, for whatever was going on, I was telling my doctor of the discrimination, the discrimination at Bell Mobility, not knowing that he was actually making notes. And I guess with some of the information, I'm thinking that maybe it's a language barrier. He's Chinese and I'm Jamaican, so maybe some of my pronunciation didn't come across well, because sometimes I say what, so I put what here. I couldn't even understand some things. But he has 97. I started working at Bell 97 and got permanent in 1998. Okay, and he mentioned here, assured she is not mentally ill. You see, because of what I was saying, I was actually explaining my over the years experience of racism at Bell. This is a letter. This is the medical notes then about racism. Okay, and my doctor wrote, assured she's not mentally ill. What did the report from the Ministry of Health had? The 17th of July 2017, see? Which one of this? Anxiety, neurosis, hysteria, you know? I went there for my Decovane tenosynovitis, mark you, but he was making other notes. This is what they have, as if I'm mental, okay? On September 16th, I went to Great Lakes Medical. Okay, and they have here for the Ministry of Health, symptoms not yet diagnosed, musculoskeletal system leg. Okay, diagnosed with Decovane, and Ministry of Health has this as a date. And on that same day, the doctor at the Great Lakes Medical, right, stated that I should ask my doctor to refer me to a physiatrist. I did tell Dr. James Chang, but I was not referred. Okay, all right. Here I am at work, 7 months at work. I was at work March, so this is now my 7th month at work with my injury still swollen. No physio. Does that you know? Physiotherapy ceased in April. Yeah, because of MANULIFE insurance. So I'm here. I wasn't approved by I was denied by WSIB. So I was on my own with my injury, using my left hand at work. Okay. Here on the 26th of September 2017, the 26th of September 2017, I went to Great Lakes again. I was off work. He said, please excuse patient from work. Okay, I was off work September 2016. Whenever I'm away from work, Bell always wants a doctor's note. One day. Never used to be like that, but it's part of the pressure. So Bell Mobility demanded that each day we are away from work, we have to bring a doctor's note. I was off one day, sick leave, gave doctor's note to supervisor. Okay, here it is. What did they have here? Habit, spasms, tics, stuttering, tension headaches, anorexia nervosa. My friends would laugh at this. Anyway, whatever that is, yeah, they have me as being mental or something. Please feel free to pause and read. This is very serious, yeah? Yeah. Okay. On the 26th of September, this is proof that I sent an email, or rather a text to my supervisor. I said, good morning, Albert. Sorry, I'm unable to make it in today. I'm not feeling well. I will be going to the doctor today. That's to get the doctor's note. So I was not mental. I'm just following procedure. Okay. See you over on part 2 of 2017. Thank you. Okay.